So our next story, which we both happened to see at the same time and kind of marveled at how we were able to, surgeons were able to pull this off. So life-changing surgery, I don't think it's an overstatement.
It seems miraculous,
to say that. It
honestly.
does. 27-year-old quadriplegic woman, her name is Jeanne Carrière, who had been unable to use her hands or her lower body after breaking her neck 2 years ago, underwent this procedure that in fact has changed her life.
It's been a difficult year. I passed from walking to wheelchair, paralyzed. But when I look back to my last year, 2022, it's been a great year because I'm alive. I survived. I see things differently now. My new life is beautiful. I love it. To open your eyes in the morning and be aware of that miracle, it's a magnificent thing.
That's her describing what she had been through and where she is now. It's amazing to hear that too. Remember, quadriplegic, basically from the neck down, had no use of anything and still able now to look back after this operation and say, I have my life back, at least to some degree. Dr. ÉLIE BOGHOSSIAN is a surgeon at Montreal's Maisonneuve-Rosemont Hospital involved in this 9-hour operation that helped that woman you just heard, Jeanne Carrière, and she's on the line right now. Dr. BOGHOSSIAN, thanks so much for your time today.
Hello, Aaron. Thanks for having me here.
Can you begin just by describing, so people hear her now, thankful that she's able to at least be able to do something she never thought she'd be able to do again. What was the procedure? What was involved in this?
So basically, Jeanne was paralyzed from the neck down after her accident. And there were a couple, so after a spinal cord injury, you have a couple muscles in the arm that are still functioning. But most of the muscles in the arm are not functioning anymore because if you want, the brain is the motor and there is no more connection between the brain and the muscles in the arm. The nerves that are the cables that bring electricity from the brain down to those muscles are not getting any input from the brain because of the spinal cord injury, which happens to block any kind of electricity between the brain and these muscles. So there are a few leftover functioning muscles in the arm, depending on the level of the lesion. And so Jeanne had some muscles that what we call donors. Basically, we can transfer nerves that go to these muscles and plug them into nerves that do not function anymore because they do not get any more electricity from the brain. So we're basically bringing back new electricity to those nerves to reanimate these muscles. So we have a couple of objectives when we see patients like Jeanne. Some of the objectives are looking back into giving pinch between the thumb and the index to be able to grasp objects as well with closing of the fingers and being able, for example, to open the fingers to go position the hand around an object to catch it or simply to open the fingers and able to type on your phone or type on your computer or tablets, which are in our day-to-day lives objects that we use very frequently. So,
I mean, honestly, when it sounds like a miracle. It sounds absolutely miraculous. I imagine it's an incredibly complex surgery. Is it an instantaneous kind of thing, or do you have to relearn how to use your hands?
Yeah, that's an interesting question. So basically, there are two things. It's not instantaneous. So these techniques were used for other types of pathologies, of nerve injuries, but were starting to be applied in the spinal cord injury population since, I would say, 2010, 2008. I think here we're one of the leading teams in Canada right now offering these types of surgeries here in Montreal for the Quebec population. So basically the result does not appear. After the nerve transfer, there's what we call axonal growth, which is basically the axon or the little cable, the electric cable that we've plugged need to grow back and reach that muscle. And the nerve regrowth happens 1 millimeter every day. So basically, from the moment we plug it, you got to wait we start seeing twitches in the muscles around 4 to 6 months, depending on each patient.
Wow.
So you see a bit of variability, and then functional activation of the muscles will appear only 1 year after the surgery, or around 1 year, and the growth and the recuperation of the nerve and the muscle will continue over 2 or even 3 years, we think. So basically, there's a certain time where the patient, like Jeanne, needs to wait before they see some active motion and can then start using these new muscles, not new muscles, but new function back in their daily living. The other thing is that there's a lot of plasticity that is needed in the brain, because we are now using a donor into a recipient, but the donor is not necessarily intuitive. So you kind of have to rework your brain. Let's say you need to rotate your forearm towards the ceiling to be able to open the fingers. So there's a training that happens with our physios and our occupational therapists. So to retrain the brain to get this new muscle and a function to become more intuitive. But the more the patient is young, the more we have a brain's plasticity, and it happens very naturally. Movements are very fluid and natural after a year or two.
Wow. I'm just listening to you describe this and how long the process takes for her to get back to the point. And I had seen her actually be so excited with just being able to cut a piece of an apple. Actually, to be able to grasp a knife and cut that apple, it's absolutely remarkable. I did want to ask one last thing, which is, this is great. She can now do something she thought she'd never be able to do again. Is there a chance she could get more mobility back? Or is this pretty much it?
Are we talking about the hands, or are we talking about the legs?
Yeah.
You tell us.
Well, yeah, I was thinking, will she be able to have any kind of feeling back in her legs at all? Or are we not able to do that yet in medical science?
So there are some limiting factors for walking, actually, because you need multiple muscles and able to be able to walk. So it doesn't just take one or two muscles to have a safe gait and balance. And the other thing is that because of when the spinal cord injury is very high, you have no donors in the legs. The only muscles we can spare are in the upper extremities or the arms. So basically, there are a couple limiting factors that make it difficult to reanimate the legs at the moment. And also the distance of nerve regeneration is very long to get back. It's simple physics. The cable is too long to get back motion in the legs. So we're not there yet. Maybe one day we will have some medication that will help nerve regeneration to happen faster, for example, but we're not there at the moment. What has been happening recently, there has been some nerve transfers that have been done for lower spinal cord injury patients to recuperate some sensation in the perineal area to regain sexual function. But this is still new and it's still innovative. So,
you're describing a situation where we still have a long way to go as far as that goes.
Amazing work.
Dr. Boghossian, I want to thank you so much for your time today. I very much appreciate it. Thanks so much.
You're welcome. Thank you for having me, and have a nice day.